Let's give a warm welcome to our guest right now. We've had her before, and it's a pleasure to have her here again. None other than our dentist doctor. It is Dr. Zerrin. Good morning, Doc.
Good morning, Noor. Good morning, everyone. I hope everyone is having a good day. And whoever is listening to us on air, my friends that are awake to listen to me, Oz, Mother, and Marina in US. It's a pleasure to be back again, Noor.
Well, we are doing good, but at the same time,
Scared, huh? I heard you. When I was driving here, I heard you. Yeah, I know.
This is Kurdistan, We have a, like Zoe's called it, post-trauma syndrome, okay? We have trauma.
Yeah.
We have seen scariness
PTSD.
before. Yes. So, how are you, first of all? How are you? You are in the medical world. You're a dentist, of course, and we'll talk about oral hygiene soon. Mm-hmm. But your thoughts and your opinion about the talk of this world, Corona.
Actually, like the medical staff, we're not as scared as the people are. Basically, if you're scared, your immune system will be lowered. So it's better.
So it's not you're not helping yourself.
Exactly. So it's better not to freak out. It's better to take it easy, but to take the precautions, the guidelines to protect yourself from getting infected by the virus. So, yeah. Basically, we're not scared. I'm not scared. I'm taking it easy. And, there is promising news is about Corona. Only 4% of the infected people die. And those are the medically compromised people, the old age, and the ones that already have medical or health issues. But the 96% of people that are infected are leaving the hospital in a healthy way. So that's a promising news.
Okay, but Barasti.
Barasti. Oh my God.
Look me in the eyes. Look me in the eyes.
I'm looking.
I'm the captain now. No, listen. Did you or did you not go last night to a gas station?
My car is emptying. Like it's on the gauge, it's on empty. So last night I was freaking out about the benzene because today I have to go somewhere that's a long drive and I don't have benzene. So yeah.
Okay. Well, we wish the best of luck of you getting benzene. Right now it's only about 20-25 minute rate, it looks like.
Oh. Yeah.
So, Dr.
Not
Zerrin,
a good news.
according to you,
Yeah.
and it's medically approved, don't be scared, don't be panicked, and
Exactly.
there are lower.
You're not helping yourself. Yeah.
Okay, so if you are scared and you're panicking, there's a higher chance that you will catch a virus
Exactly,
or an infection.
because this is psychological. It affects your immune system. So once your immune system is down, you have more chance to get the virus. Though I'm not a specialist to talk about Corona, I'm not an internist, but this is the common sense. This is the what happens in medicine. Once you're scared, your immune system gets down. That's true for all kind of viruses, not just Corona.
Well, Doc, thank you so much for that. But we brought you here because we really, we want to care about our full body, okay?
Mm-hmm.
Especially our dental hygiene, it's really important. It will determine many things, like, for example,
Exactly.
if people like you or not.
It's directly exactly. Yeah, it's directly connected to your general health, the oral health, because it's essential to your overall well-being. Once you have a healthy oral cavity, you're promoting your general well-being also, because once you have a poor oral hygiene, you're more susceptible to get cavities, gum diseases, and it's proven to many studies that are published in American Journal of Dentistry that poor oral hygiene and gum diseases are directly they are directed to endocarditis, heart problems also. So, yeah.
So let's talk about some just beginning ways, just right off the bat, things people should, because a lot of people are going to be arriving at work right now. We want them to hear the good parts. So tell us first, what do you tell the person once they come, to your clinic, they get the checkup and stuff like that, to have an important oral hygiene? Mm-hmm. We know brushing your teeth is important. We know that. But we don't know exactly
how. Do you do it?
But do we do it?
We all know these things, but we're not, I'm not going to say that I'm perfect in flossing, let's say. But many people tend to forget the ABCs of oral hygiene. what you should know is that you need to brush at least twice daily. You need to floss. This is really important because the food that are kept between your teeth are not being cleaned only by normal brushing. So you need to use flossing, especially when you're eating bread or, let's say, potato chips. Those are starch, and the enzymes in your oral cavity breaks them down to sugar. So it's important to floss after the meals that you're having, and it's important at least to floss once daily, and you need to brush your teeth and use a fluoridated toothpaste. At least it should have 1000 or 1500 ppm in it. You need to look for this when you buy toothpaste, and it's better if you go see a dentist at least twice a year, even if you're following all guidelines.
Even if you have no pain.
Even if you have, exactly, I'm gonna come to that later, because people only tend to come to dentists when they have pain.
Right.
Yeah, I know. This is, you need to go to dentist twice a year, even if you're following all the guidelines, because there are many problems that are detected by the dentist before it reaches to the point that you have pain. So you might not even have the symptoms of pain, and you might have a cavity. So if you go to a dentist, so the idea is that if you catch your problems earlier, it's less costly for you as well.
Yes, much cheaper to fix a cavity.
Exactly.
When it's not painful as when it's, you know.
When it reached root canal, when you need to do crown.
Take the tooth out.
Exactly. So those procedures are more costly. But if you have a tiny cavity, or if you detect it before that, it's less costly for you also. So you need to visit dentist twice a year, also for routine cleaning of your teeth, which is done professionally by a dentist and dental team. You need to do that. What else? You need to stay away from sugary diets. This is the most important
But we
part.
love sugar.
I know, Noor. I know you do.
We love baklawa, and we love everything that's sweet. We love to have, what do you call that thing? Like we want to put this much sugar in our tea.
In your tea.
Not lokum. I'm talking about
Sugar.
the size of your your
Quarter
glasses.
of
Chabastika.
Yeah. Okay. Well, let me ask
can
you
we enjoy
questions.
life? Can we enjoy life by eating sugary things and be healthy?
Yeah. Okay. I'm gonna
Early.
ask you a question, guys.
Let's
When
go.
do you eat your desserts? Like when do you eat baklava?
I don't eat baklava, but
Desserts.
you-
When you
dessert like after dinner.
Okay, that's good. And you, Noor?
Yeah, it's like that. It's after dinner. It's usually dinner to hit the stomach one more time. A big punch.
Okay, so the thing about sugary food and the sugar diet itself is it's not about how much sugar you eat, but it's about how often you eat it and when do you eat it. It's important to eat your dessert directly within the meal, like with the meal, not between the meal as a snack.
Adi.
No, it's
In the middle.
No, like when you finish your food, immediately after you can have your dessert, but not between the meals. For example, if you have a meal at 12 and your other meal is at 6, you shouldn't eat it around 3 or 4. This is really bad. You should eat it with your meal. I mean, directly after your meal. And that is why, because while you eat, the saliva production in your mouth tends to be higher, and saliva is a naturally flushing of bacteria and the acids that are produced by the bacteria. So if you eat dessert within that time, this saliva will protect your teeth from having cavities. But if you eat it between the meals, the saliva production is not as much as within the meal. So the sugar with the bacteria in your teeth will produce acid, and this acid will create cavities, holes in your tooth, and that's how dental cavities and decay happens.
And that's why it's very important to brush your teeth when you wake up, right? Because the saliva production stops
Within the
at
night,
night,
yes,
right?
exactly. It slows down. It's body physiology. Everything slows down when you sleep.
Right.
One of them is saliva production. So when you sleep, saliva tends to be lower.
Yes.
So there are many people, like I see them, they have desserts at night before they sleep. Oh my God, this is the
Right
worst
before they
thing.
sleep.
This is worse than Corona. You do to yourself, seriously.
So, doctor, you mentioned that you have to clean your teeth professionally, get them cleaned at the
Exactly.
dentist
Yes.
twice a year.
Twice a year, yeah. If you're a smoker and like you have a bad oral hygiene, it should be 4 months.
Four times a year.
4 months So it's
So
three
every
times
4 months. Okay.
every 4 months. Yeah.
Why is that important to get them professionally cleaned? Isn't flossing and brushing your teeth important? I mean, enough?
It is enough, but there are, when the bacteria accumulates, it forms some type of calculus, dental tartar, and this is not removed by normal brushing and flossing. You need to go to the dentist, and another reason is that the dentist within those 4 months is gonna detect, or 6 months is gonna detect any problem that's happening in your oral cavity. For example, if you have ulcers, if you have bleeding gums, or any other problems, the dentist is gonna detect it earlier.
And how often do you have to brush your teeth in a day? I know some people overdo it, some people underdo it. So how many times a day at least?
The best amount is twice a day. And another thing that I wanted to say is that many people come to hospital or the clinic. They say, doctor, we brush our teeth like after every meal. So this is another thing that I want to say. It's one of the worst thing you can do if you brush your teeth directly after eating, because once you eat the bacteria with the sugar and acids you eat in your food, tend to make your enamel softened. So once you brush after your meal, your enamel is softened, and when you brush, it's gonna create lines, micro lines in your tooth, and it's gonna make it rough. And a rough surface for a bacteria is one of the worst things, because it's going to attach to it, and it's going to make dental decay and tooth cavities with it. So you need a smooth tooth, basically, for the bacteria not to attach to it.
So you've been a dentist for how many years?
4 years now. Oh.
4 years.
Yeah.
And you have a practice,
Yes.
a place where people come and
Yes.
you clean their teeth and all that, right?
All other type of procedures also, yeah.
Good. So in the past 4 years,
Yep.
let me ask you, how have you seen, honestly, the dental situation with the people that come in? Has it like, maybe it started at one level, has it gotten better, worse? Have you seen like more oral hygiene, more awareness? How is the dental scene?
It actually, it's a happy news, because the awareness is raising among people. It's really promising thing. People tend to come to dentists only when they have pain. This is the thing we wanted to talk about, because
right.
they only come when they have pain. But luckily now people come for other kind of procedures, like they want to come only for cleaning, even when they don't have symptoms. They come for aesthetics mostly nowadays. Whitening, dental veneers, crowns, implants. They seek these kind of procedures also. But before, they only used to come when they have they need to extract the teeth, or when they have pain.
Right.
And this depends on the area and the population. There are many people that, for example, the places outside Erbil, the oral hygiene and awareness is not as much as, obviously, the people that are living in the city.
Yes.
Yeah. So I work outside Erbil also in the morning at government.
That must be an adventure.
Yeah, I try to explain as much as I can during my duty at outside Erbil. I try to tell them, advise the parents how to take care of their children, how often they should bring it. According to WHO, dental caries is not only, like, let's say, it's not only something very common in Kurdistan. No, it's common in all the world. Nearly 100% of adults around the world have at least one dental filling. Nearly 100%. So
I have.
Yeah, nearly 100%. So everyone in their lifetime, it does not depend if you're from Europe or UK or US or Iraq or Kurdistan. Everyone has it, but as I said, it depends on how often you take care of it and your oral hygiene.
If you guys are joining us, this is our friend dentist, Dr. Zerrin, talking to us about some just basic ways of having good practices of having good oral hygienes and preventing any more problems and crises for you, because we have enough crises. Well, we don't want more.
Yeah.
And you've told us some of the important things in terms of steps that we need to take in order to stay healthy orally and our teeth become shining and cool. I think the most important thing I've heard you say so far is just come to us. Come to the dentist twice a year minimum. Every 6 months, Go to the dentist, even if you don't have pain.
Exactly.
Hey, doc, look at my teeth. What do you see? What's going on? Going to the doctor is not as painful as it was before because of the technology.
Exactly.
Alhamdulillah. Like, I remember how much I would cry of pain, Zayn, when we were like 12, 13, 14 years old. I don't know how your technology was when you were 12 or 13.
That means you didn't take good care of your oral health. You had pain.
Oh yeah, I had
Obviously.
pain all my life. No, I mean like when he went to the dentist to like treat you, and like when he dug a hole or when he
The
did
drill,
a filling,
the sound
drilling.
of the drill.
But before that it was just really, we didn't have what we have today where it makes it pain free. But the bench of today is so much better than. We didn't even have bends back then. It was only rich people who could afford bends. You know what I'm saying? So going to the dentist is not as painful as before. So we should not have excuse. And it's not really that expensive, right? I mean, the average person when it comes to the dentist, how much is he paying?
According to the procedure,
تقريباً.
I mean, what exactly do you need? A professional
يعني.
cleaning, a filling?
Let's say a regular, just a regular checkup.
Regular
There's no
checkup.
complications. Just a regular checkup, just cleaning and 6 month, your 6 month checkup, no complications.
I think Zayn, you should to come in and get your answer once you're in the
I
clinic.
think-
I do not give.
I think it's
advices
cheaper
here.
than going to a restaurant for some people.
Yes, definitely. It's much cheaper
I
than what
agree.
you spend.
But for me, I'm a little bit hesitant. I haven't been to the dentist in 3 years.
No.
3 years?
Wow.
Zoe, how about you? Last time you went to the dentist?
I do my regular checkups because I had some teeth problem because when I was in school, somebody broke my tooth, so I regularly go to
For
check
you.
my yeah.
What, you got in a fight?
No,
Dang.
I was being
I
She
didn't-
chased.
doesn't look like someone
I didn't know
who
you was
gets
like
no
that.
fight.
No, I was being chased.
Zoe's vicious.
Dr. Zerrin, do you like your job? Do you like your profession working here in Kurdistan?
Yeah, I love it.
But do you feel like there's too many obstacles and it's too difficult? Do you ever look at, for example, I'm sure you have dentist friends in America or in Europe, and they're doing their jobs, and you guys share stories and stuff like that. Do you ever were like, man, I wish I was a dentist in America because it's like this or this or this? Yeah, and you think like, no, it's cool, it's everything I do. We're good here.
Actually, no, I love it working here. I love to serve my people, really. This is not something that I would just say on air, but I really love to serve the people here because if I leave, another dentist leave, I mean, who's going to teach them? The awareness that they need, the service that they need. No, I actually love working here. Yes, there's obstacles. Everyone who gets in medical field already knows that you're going to have many obstacles in your life within the medical field, but this is something you sign up for it before.
Do you have like nightmares of like dentist problems or tooth problems?
Not really.
No.
I don't know. I'm taking it easy.
What do you do for fun? I didn't ask you that question last time we were here. What do you do just to get your mind off of tooth and teeth?
I go to gym, spend time with my friends. Yeah, but usually my friends are also dentists, and
So you guys
we
all talking
end
about
up talking
dentists.
about dentistry.
But that's a very natural thing.
Do you get together and discuss people's teeth? Like, oh, Noor
Yeah.
came to me today. He has the most.
Well, like
Yeah.
we don't mention names because they're not gonna know who my patient is. But
Yeah.
we're gonna talk about the different type of case. I mean, if you look at the bright side, you're gonna learn more when your friends talk about their cases. Also, I mean, you're gonna learn something from their experience. Also,
I like how, you young people are really motivated about your profession and you want to continue to learn and you feel like you have a purpose more than just making money in terms of serving. That's so important. When you reach that point in life where money doesn't control your life, but
Yeah.
your passion does, everything becomes so beautiful.
patients are very smart. Also, they see that in you. They see if you love your job, they're gonna trust you more. This is also psychological. If you don't like it, they're not gonna come back to you. Like your job as a dentist depends on how often you keep. It's not about the number of patients come to you. The most important thing is when the patient comes to you again, like that patient, if you've satisfied them enough, if they come back to you, then that means you're a good doctor, not the amount of the patients that come to you.
Well, we approve of you. You're a great doctor, Dr. Zerrin.
Thank you very much, Noor.
Thank you so much. How can people contact you if they have questions or if they want to come to do checkups? What do we have to do? Can we contact you directly on Instagram?
Exactly. That's what I was going to say. I don't have a lot of time to spend it on social media because of the time that my job is taking from my life. But they can message me and I try to reply as much as I can. And they can also anytime visit the hospitals, the doctors. I'm sure not just me, everyone is ready to answer their questions and they can visit my clinic also if they have other crutches.
Find Dr. Zerrin and her clinic or wherever she works at on Instagram, dr.zerrin. That's 2 R's. dr.zerrin, Zerrin, and then Kamaran, just like Kamaran is spelled. Look her up, and like she said, she's really famous. It's not like us, we only have 35,000 followers. She has 177,000 followers, so she might not have as quick of a response rate as us, but give us some time. I'm sure she'll help you. Anything we say anything you want to say before you say goodbye?
Take good care of your tooth. Stay away from sugary food. Visit dentist, floss and brush, and stay away from alcohol and tobacco, smoking. I mean, you can do them, but you have to at least keep it to the minimum.
Moderation.
Yeah, moderation is the key. Yeah.
Thank you so much, Dr. Zerrin. We'll see you at the dentist office.
See you. Thank you, guys.
Before we have any problems, we're coming for a full checkup.
Sure. You're welcome anytime you want, guys.
There you go.
Thank
Thank
you.
you.
You're welcome.